That to a bit of health news, and Kenyatta University Teaching and Referral and Research Hospital has become the first public hospital in East and Central Africa to conduct cancer screenings using PET scans. The new machines are able to detect cancerous cells in the body faster through imaging. One will be able to know their health status far much earlier, I should say, and boost the chances of beating cancer. NTV's Helen Aura with the details.
The burden of cancer continues to be a thorn in the flesh for many Kenyans, condemning families into financial oblivion as they seek to have access to treatment. Now, the Kenyatta University Teaching and Referral Hospital has begun cancer screening using PET scans to help with early diagnosis.
We have decided to be doing 2 shifts, and that way we'll be able to scan about 50 Kenyans per day using the 2 machines.
According to data from Globecant Kenya, the leading types of cancer in the country are breast cancer, cervical cancer, prostate cancer, esophagus cancer, and colorectal cancer. With cervical cancer being the leading cause of cancer deaths in the country among women, and prostate cancer the leading cause of cancer deaths among men. The PET scan machines will help doctors know the metabolic activities of the particular tumor, as well as the exact location, further detecting abnormal cells in the body.
We get a referral from the oncologist. We inject the patient with something called as FTG, fluoroxydeoxygen glucose. And this is the one which gets concentrated. It's a glucose analog basically. It gets concentrated in the cancerous cells in the body. So depending on the area of affection is what the doctors now decide where the treatment should be given.
Once injected with the FDG, the patient becomes radioactive.
So once the patient is injected, we give them around 55 minutes to 1 hour for the uptake time, what we call as an uptake time. And this is just mainly to make sure that the glucose is disseminated in the body and concentrates in the area of need. Usually the scan time is around 25 minutes.
We will be charging 40,000. So if you have it approved by NHIF and you come here, you'll not be required to add. But for now, we will charge that and then work with the NHIF to see whether they can increase that amount for us.
Patients who will pay cash for the services will be charged 55,000 shillings, while those under private health insurers will be charged 60,000 Kenya shillings for the procedure. Helen Aura, NTV.